CBT. CBT, ma.
We'll stop at CBT, ma.
Cognitive behavioral therapy.
Yes, ma'am.
Is that okay? Is that where we stop?
Eating disorder, ma.
Eating disorder.
Yes, ma.
Did I give any assignment on that?
Yes, ma.
Can we quickly present the assignment? Let's quickly present our assignment so that we can go ahead with the class.
Okay, ma. We share the assignment among ourselves.
Yes, ma. Present the one that they shared to you, ma.
Okay,
then
ma.
the next person presents like that.
CBT on rehabilitation.
Okay, ma.
So I'll go on now. So definition of cognitive behavioral therapy model suggests that a person's thoughts, feelings, and behavior are interconnected and influences each other. So this CBT suggests that our interpretation of situation, that means our thoughts, significantly impact how we feel and how we behave. For instance, maybe I have an issue with someone, or maybe something happened to me. For instance, if I happen to be a victim of maybe rape or sexual assault, so my feeling could be that, okay, when people are looking at me, I'll be feeling that these people are talking about me, and that one will make me to probably withdraw, or it might end up in a substance abuse. That means it's variably the way I'm feeling now affects my what's it called now? It affects my thoughts, then feelings, and at the same time influences my behavior. And this model was developed by Aaron Beck in 1960s, and I think to large extent, a lot of research has been done, has been used for this, and eventually it came out effectively. Then we have CBT is a kind of a circle which has to do with the thought. That means the thought creates feelings, then feelings creates behavior, and at the last circle, behavior reinforces our thought. Then, if you have to look at the features of a CBT therapy is structured, demoralistic, and goal-oriented form of a therapy. So it's goal-oriented in the sense that, when we apply it, we are looking forward to get something what's back. So that means as a social worker using that, then that means we are trying to help or probably modify or change the behavior of our clients. So then the approach is hands-on. That means that is practical, wherein we, the therapists and the patients, work in collaborative manner. And in that way, then we are trying to do to modify patterns of thinking and behavior to bring about beneficial change in the patient's mood and the way of living he or she is living his life. Then we look at it that it's at the same time, one of the features is that it is used to help a wide range of problems, and appropriate treatment protocols and apply depending on the diagnosis and problems the patient is facing. So therefore, CBT is highly acceptable form of therapy in rehabilitation process. Then rehabilitation now is defined as a set of interventions designed to optimize functioning and reduce disability in individuals with health condition in interaction with the environment. So rehabilitation, it is various types. So each tailored to address specific needs and conditions. So applying CBT now, it now depends on the problem the person is facing. So this could be, it could be physical, it could be on the occupational. Then at times it helps in cardiac issues, the neurological problem. Then we use for pediatrics and a lot of others. Then the use of CBT for rehabilitation now. So CBT is a widely used therapeutic approach in rehabilitation setting for addressing various mental health conditions and promoting recovery from addiction and other challenges. What we are seeing is that CBT, when it comes to rehabilitation, because we say rehabilitation is helping people to come back to their normal self. So using CBT now, we use it to do what? To modify and address the issues, maybe the particular thoughts of an individual. So it helps the individual to identify, number one, then it change negative thought pattern and behavior, that contribute to the person's problem. And at the same time, it will equip them with coping skills to manage triggers and maintain positive change. Then we look, how does it work in rehabilitation? I think, it has a process. The first things are to identify the triggers. What are those that triggers the thought of the individual? So CBT helps the individual to recognize and understand the situation, then these are thoughts and the feelings that trigger craving or problematic behavior. For instance, I said earlier that, okay, using myself as a victim or a survivor of a sexual assault, then in that case, something triggers it. Maybe the stigma, people around us, their reaction to it. So see them at every point, I'll be looking at them. These people are talking about me. Then at that point, I'll be blaming myself. Why do I do this? Then probably it was the way I dress. So this CBT addresses the why and the feelings. So at that point, then it was those feelings that now trigger my problematic behavior. It could be, okay, by my result in eating too much, or withdrawing, then sleeping too much, or at times it might end up in a substance abuse. Then another step is cognitive restructuring. So by challenging and reframing negative or distorted thoughts. So CBT it will help me as an individual to develop more balanced and adaptive thinking pattern. So when CBT is applied, at a point I'll be able to look at it. Okay, even these people, because that will be the work of the therapist anyway. They'll tell you if they are even they might not even be talking about you. Then at the same time, as a therapist, my therapist might tell me what they are saying. Just look at them; they are just saying it. You have nothing has changed you. Nothing has changed about me, and that one will help me to do what? To restructure my distorted thinking. So, and thereby it leads to developing coping skills. So CBT at this point will equip me as an individual, with a practical skills to manage the stress, the behavior, the distorted thoughts, and the outcome of that distorted thoughts. So then at the last stage, relapses prevention. CBT will play a crucial role to relapse prevention by helping me as an individual to anticipate and prepare for potential challenges and setbacks. So then I narrowed it down to the what's it called now? The example I'll be giving that I gave earlier, which is a sexual trauma. So now applying to a sexual trauma victim. So CBT is highly effective approach for treating post-traumatic stress disorder. So, and trauma in sexual access victim. So it focuses on the relationship between the victim's thoughts, our feelings, our behavior. Then at that point, helping the individual now, the victim, the survivor, to do what? To identify and challenge the distorted thought that or any unhelpful thought related to the trauma. So in CBT, patients learn to replace negative thoughts with more positive and realistic one, which can reduce feelings of guilt, shame, and anxiety, of which often associated with sexual assault. So I know it's in phases. If the first phase is stabilization, at this point, no, the stabilization help the sexual victim now to understand the trauma, its symptoms, then its effects. So if you understand the symptoms now, probably looking at people or some other symptoms, then you'll be able to curtail, you'll be able to control your thoughts. Then the effect too, looking at the effects on then the survivor learn emotional regulation, be able to regulate your emotion, then how to express your feelings, then the realization technique. Then in this phase now, it focuses on
Thank
coping
you,
with
ma'am.
trauma.
Let another person present their own. Thank you, ma'am.
Thank you, ma.
Next person, please.
Okay, good morning, everybody.
Good morning, sir.
Yes, ma'am.
All right.
So I want to talk
Can I
about
go ahead? Can I
CBT
go ahead,
in
ma?
counseling
Mr.
center.
Mr. Konde has the floor. Let him finish,
Hello,
then
ma.
you take it.
Thank you, ma'am. All right, I will be dealing with CBT in counseling centers. So as we all know that CBT is widely used in schools, in university and community counseling centers. And due to its effectiveness and structure format, key areas of application include treatment of anxiety and depression. In a way where clients learn to identify automatic negative thoughts. We all know that our students, different kind of thoughts comes to their mind, and these affect them. Okay, for example, now a student that is always say to himself that is a failure, or maybe something bad is going to happen to him. We use CBT as a technique like thought record and cognitive structures. Structuring help them to challenge and replace all these thoughts. Okay, then behavioral strategies like exposure therapy for phobias or and activity scheduling or for depression are also always employed. For example, about that, a student experiencing text anxiety might be guided to explore thought like I always fail exam. So they normally help them to me ask them to challenge it with evidence, like I will pass my exam. Then we also tell them to practice breathing techniques and mock test scenarios. So another one is stress and adjustment counseling. And we all know that CBT help clients to cope with life transition and academic stress or relationship issues, where counselors use stress diary, realization training, and cognitive reframing to support better coping. Then we also have a behavioral modification. So in counseling center, they use behavioral modification and habit change, where clients struggling with procrastination, addiction, yes, or unhealthy habit. We use CBT to help them to experience behavioral experience and to also reinforcement schedule self-monitoring. And then we also use CBT in our counseling for to build self-esteem and social skills, um, whereby CBT can be the smart to internalize negative belief like I am not good enough. Okay, and this include assertiveness training, positive self-talk, and role-play social interaction if needed. So we also have some other tools commonly used in CBT at counseling center like thought record, activity schedule, mood diary, and a cognitive restructuring worksheet. So to help our client. So CBT is structure. It's a collaborative, it's used as collaborative and skill-based approach to make it a highly effective model in counseling centers, whether addressing anxiety, depression, self-esteem, or life stressor. And CBT is also empower clients to gain insight, develop resilience, and build practical coping strategies. It is adaptability and evidence-based nature that make it indispensable in modern mental health care. Thank you. I'm
Can
Doma.
I go ahead now?
Hello, everyone.
Yes, go ahead. Yes.
All right, ma. All right. Good morning, ma. Good morning, everyone. The question this morning is discuss 4 core areas of cognitive behavioral therapy, that is CBT models, and how they apply across various settings. And I am to handle clinical service. So before I will go into the 4 areas of the cognitive behavioral therapy, I would like to define what CBT is. It's a type of psychotherapy that is goal-oriented, structured, and time-limited, that gives psycho treatment that helps people identify, understand, and change unhelpful or negative patterns of thinking, behavior, and emotion. So the central idea is that the way we think affects how we feel and how we act. And so 3 major things are involved in CBT. One is cognitive, that deals with our thoughts, what you tell yourself. Then behavioral, that is our action, how we respond. And therapy, that is the process, the treatment process. Now, we have 4 major theories that I'm just going to run through. We have Beck cognitive model that deals with, that suggests that psychological problems can stem from distorted thinking patterns, and also known as automatic negative thought, that comes in. By identifying and challenging these thoughts, individual can improve their mood and behavior. Then we also have behavioral model, and that is stemming from our learning theory. So this approach is to just to emphasize the role of learned behavior and environmental reinforcement. Problem behavior can be identified, unlearned, and replaced with healthier responses. We also have ABC model. This model explains how an activating agent, that is A, the trigger belief, then B, which produce emotional and behavioral consequence, and C, changing unhelpful belief can alter emotional responses and action. And we also have integrated cognitive behavioral model. This model blends both cognitive and behavioral concepts together, emphasizing their interaction in the development and treatment of mental health issues. And lastly, we have social learning theory. This suggests behaviors, including problems, behavior that are influenced by observation, modeling, and reinforcement received from the environmental and others. Now, going to how clinic attend or handle CBT in treating their clients. So in clinical service using CBT, the therapy help the clients help their thoughts and let them know the particular area that they need to. So we have clinical employed individual CBT to target specific symptoms and promote healthier thinking and behavior patterns through assessment. Number 1, you assess your clients the moment they comes in. You look at their countenance, you go to their history, you ask them questions so as to assess, the problem that they have brought. And through all these assessments, you are able to diagnose, having going deep into, the root cause through the assessments that you have, taken, you have gone through with them. And after diagnosing, you go to intervention. The intervention now is, what do you want? How can you help them through their thoughts? For example, if somebody have the feeling of, I am a failure, you want to give intervention to that particular person, you first of all let him or her see why that thought comes in. That is to go deeper into what happened before that time, what experience, what encounter. Through that, you are able to see deep why he or she has that thought. If the thought is as a result of he or she has failed so many times, you can ask questions, that can change that distorted thinking about it by changing it to a positive affirmation. Give them positive affirmation. Let them see that they can try it again. Have you tried it again? When they try it again, give them options of what can happen. So you make sure that you are able to change that particular thought to a positive one. And having done that, you have to follow up on your client, as a clinical role that you have to, perform to your client. So common strategy include cognitive restructuring, that is challenging distorted thinking, behavioral activation, that is to encourage positive activity, exposure therapy, that is reducing avoidance and problem solving skills. So in other words, clinical services, gives therapy work with clients to identify irrational belief or negative automatic thought, contributing to issues like depression, anxiety, even eating habits, and so on and so forth. So intervention targets these thoughts to help clients achieve symptoms relief.
I've lost your voice. I don't know if it is my network. Is it my network?
Okay, should I go through it again? Please, class, do you hear me?
We are hearing you now.
Okay.
I don't know if it's my network, but I'm not hearing you again. The next person can present if she has issue with her network. Let's move ahead so that we can do something in the next 1 hour, please.
Good morning, class. Can you
Good
hear me?
morning,
Good
ma'am.
morning.
Yes, we can hear you. Please go ahead
Yes.
with your presentation.
Yeah, the question given to me is on CBT, how we can use it in eating disorder, ma. And then we have the definition of CBT here is a widely used treatment for various eating disorder, including binge eating disorder,
I don't know,
bulimia,
my network is bad.
bulimia nervous. Okay, did she want to?
No,
Hello, can
please
you
go
hear me?
ahead. Go ahead. I want to use the next. Go
Anorexia
ahead.
nervosa. So it focuses on changing negative thoughts, pattern, and behavior related to eating habits. In the university setting where I belong to, the students most of the time have issues with some certain foods, like they don't like to take beans, and some of them, the doctor recommended that it should be in their diet. So we have issues with that. And how do we handle that? We let them see the reason why they have to take beans, because that's the only source of protein majorly that they are taking in their diet. Some of them find it difficult to adapt with it, but as time goes on, they may not really take it the way we expect, but maybe we just work with the people at the cafeteria. We tell them maybe you can mix small beans with their rice, maybe. And the students, majority of them love taking rice, and then with that, at least they are taking beans in their diet, which is better for them. And then identifying distorted thoughts. Patients learn to recognize harmful thoughts about food, weight, and their body image. Some of them, when you go close to them, you notice that at times they feel that they are too big in size. They feel that, oh, their body image is not the way they want it to be, and so some of them stop eating. It becomes an issue for them. They will not eat well. Some of them, they don't drink well. They will not drink water. Some of them, it's either they are always taking minerals, which is dangerous to their health. So as a social worker, we also assist them in giving them orientation that uh, even without taking water is injurious to their health, and it could cause a damage to their system. So challenging belief. Therapists help patients assess the accuracy of these thoughts and develop healthier perspective. Behavioral components. Changing eating behavior could be very stressful, because when you are trying, this is the habits that students have from their home, maybe from the house. They just eat anything they want to eat. Some of them love to take indomie and the spag and all the rest. But when they get to the school setting where we are not serving them all those food, it becomes an issue. Then social worker will have work to do in that area. Patients practice skills to manage social situations and emotional responses related to eating. And we also have a structure of CBT session. Individual or group therapy session can be conducted one-on-one or in groups, depending on their need, on the student's needs. We at times we gather them together, we call it all assembly. So we give them orientation on what they need to eat, the benefits of it to their body, and at times we achieve our goals. You see few of them turning up. Some of them will not even enter cafeteria. You see the food wasting away. At times the cafeteria units, you will see them, they will bring cooler of foods, especially food that students don't like beans, as I mentioned earlier. They will just bring it to the doorstep of the dormitory and be paging that students should come down to take their meal, which is not okay enough. So therapists, we may use role play to prepare our client for challenging in situation, and assigned homework to reinforce learning. Effectiveness of CBT, short time treatment. CBT is typically a short time therapy. It doesn't stay for long, often involving around 20 sessions. Proven success. Research shows that CBT is effective in reducing symptoms of eating disorder and improving overall mental health. If they eat the right thing at the right time, it also help them. And also some of them, they have habits of eating very late in the night, maybe because they are reading. They have to read in the night, and then their mouth will just be busy throughout the night. We also have issues with it. As a social worker, we also orient them. We give them orientation that eating late is not okay for their system. Some of them will take to it, while some of them will still ask you question why they should not use their mouth whenever they want to eat, why they should not eat late in the night. Then we have 10 powerful CBT techniques for eating disorder. Cognitive behavioral therapy is a form of psychotherapy that help people manage their thoughts and behaviors to heal from mental health and condition. CBT has been shown to be effective treatment for depression, like those that are depressed, maybe they lost their loved ones, and those that are having anxiety disorder, those that have issues, they would CBT has been of help to them. OCD, PTSD, and eating disorder. Whether you are navigating binge eating disorder, bulimia nervosa, and all the rest, CBT can help to manage the stress, changing distorted thoughts, and build new recovery behaviors, including overcoming common patterns like all or nothing thinking. Learn how to frame all nothing thinking here. So many issues that we have to deal with as students have issues on their eating habits. Some of the parents, when some of the students that are slim, when they resume school, by the time at the end of the semester when they get home, the parents will be calling the school and be asking us, how did you do it? What are this thing, that miracle that you performed, that my daughter turned weight? Some of them will call us and say, oh, my daughter, they are looking good now, and that is a plus for the university. And then some of the students, at times, they are on drug, they have maybe health challenges, and then the particular food that the doctor have told them that they should stay away from, that is what they would like to eat. That is a serious challenge for us. At times we have to tell the cafeteria unit that they should prepare several meal, like those that are having those that are diabetic, they have their food different from those that are having
Special diet.
um so many health challenges that we deal with at the university level. And then some of them are addicted already. Before coming from home, they are already addicted to drug issues. For us to now start stemming them, to start telling them, oh, you need to stay away from drugs, it will damage your life and all. It's a lot of work. So I don't know. I think that is all I have for food. Uh, that's what I have on my page, ma. For
Thank you, ma. Really enjoy
yes.
that.
Yeah. Okay.
Hello. Next person.
Okay.
Who has taken over the command of my class? Shware Akondi.
Sorry, ma. I'm sorry.
Are you the class rep?
Yes, so you are our
Okay, you
middle
the
class
class
rep.
rep.
Yes, sir.
Okay,
So our
okay,
clear.
sorry. Okay, sorry about that. I didn't know that you people have gotten a class rep. So which
Yes.
theory is the next one that we are treating today? You see, why I ask you people to all look at the issue of CBT, that's the cognitive behavioral uh, therapy, is because every issue that happens to us that we tag as a social issue starts from the thinking faculty of every individual, either from the positive side of the thinking of a particular individual that causes problem and make it a negative side of a thinking of another particular individual or group of people, or a negative side of thinking of a particular individual and make it a terrible issue for another set of individual. Please, if you are in my class, off your video.
Okay.
Akintunde Folakemi, your video is on. Off the video. So that you don't distract others. Just click on that video button. Once you click on it, it will off it. You are still on. We know you are very beautiful with your glasses on. Off your video and let us continue. A máa dáre o, ẹ̀yin ìyá dẹ̀ nìyí. Thank you. I can as well put on my video, but it will be distracting others. Some people will be trying to count this type of ceilings you have in your video.
I'm sorry, ma. Sorry, ma.
And no problem. It's just that we don't want to disturb others. So some people might have a very negative thought about a particular issue. Then that negative thought could be a positive thought to some particular set of people, and they adopted that negative thought of that particular person, and before you know it, if care is not taken, it becomes a normal norm for every other person. that is around those who have adopted the negative thought. And before you know it, it becomes a social issue. It becomes a social issue, and everybody starts to do it, and then some other group of people would love to provide solution to those social issues. So those are the issues around. So we try to approach it from that cognitive area of the therapy, so that every one of us will have it at the back of our mind that everything around us that becomes a social problem or social issue is a thing that comes up from a particular individual, and it attracts some other group of people negatively or positively, and it becomes a thing that is not acceptable within a particular group of people or society as a whole. So those are all the things. Please, mates, put off your mic, please. Put off your mic. Cross it, so that you don't disturb the class. So these are why I ask you people to really go and read on that CBT, so that you will learn a lot of issues on CBT. You see, is very, or I could say, many of us did not really read deep. We did not read deep in the sense that we are unable to talk about how a particular issue gets into the stage of depression. And then by the time we got to that depression issue, we now look for a succor to curtail that depression, or an alternative to take away the depression or solve the depression. Then we sometimes go into addiction, sometimes we go into a particular habit which we think is an alternative habit, and it becomes a thing that is very harmful to the whole of our body in general. And before people will know it, it becomes an issue that we might not be able to really solve just the way it started. It might become a community issue, it might become a general issue, it might become the issue of the whole nation or the issue of the whole world. Because unfortunately, when it started, many of us did not see it as a thing that is uncalled for, as a thing that we could really stand up against when it started. So we left it like that, and we think that by the time we leave it like that, nobody, it will change, or it's not our business, or it's not part of us, and we continue to see it like that, and things like that continue, and it becomes a social norm, and unaccepted norm, invaluable norm, and unchangeable norm, because it added no value, no positive value to the society. Rather, it's bringing about unwanted issues, and we are taking it lightly, and sometimes we get to a corner and ask ourselves, what really leads to all of this? Why don't we all stand against this when it started? So those are the areas that I think that some of us will really touch, so that we can all learn from ourselves. So I will still plead with us to share all that we have presented to the whole of the classes. Maybe we share it among ourselves, so that we don't polarize the chat or the group discussion. But let's share it among ourselves. Let us all read, because the institute is trying their best to bring the best of the best lecturers to us, so that we can learn deeply what social work is all about. It's not that we are condemning the four corner of the universities, but it's unfortunate that many a times those there are not really ready to give the details of what it has to take to be a social worker to every one of us. So that's why the institute is having all of these courses, so that we can really go deep into what social work is and how to practice perfectly as a professional social worker. So we really need to go back and read more about cognitive behavioral therapy. Many of us did not even touch the models. I heard somebody mentioning different types of models, but the person did not really touch the models the way I expected that person to really touch that model and break it very well, so that we can all enjoy the presentation. With that it may, let us try as much as possible to look at that PPT and see clearly and clarity what is the issue around the cognitive behavioral therapy, so that we know how to apply all these therapies, when to apply them in the clinical section, when we talk about mental issue, when we talk about disorder of some organs that are put in the forehead, disorder of some organs that navigate the strength we have to move around, which affected our spines, disorder of so many things within these organs that make up the settings of the body. When you use some drugs, whether recommended or unrecommended drugs, and it affected some other parts of the body and brings about misbehavior or disorderliness within and around us. Sometimes we use some drugs and we react negatively to it, and sometimes it knock us off and we sleep, and before we know it, we started to have sleeping disorders, because if we don't continue using it, we might not be able to sleep again. And sometimes we use some drugs, it makes us to wake up, and before we know it, we will find it very difficult to even go to sleep again. And then we use some drugs and it really knock us off, and we stand up and we start to misbehave. All of these are issues that has to do with the ones that is happening around us. And sometimes we use a very tiny drug, and before we know it, we are at the rehabilitation center, and they are trying to help us to gain our consciousness back. It's not even our thinking habit that took us there, but it's as a reaction of some drugs that we take into our body, and it could be a recommended drugs too. So these are all the things that we are expected to really read deep. We are expected to read deep. Please, I would still want us to go back and devote just 2 days for yourself and read deep about cognitive behavioral therapy, because it's one of the key tools that is used in social work to solve a lot and lot of social issues that will be bring or they will bring and they have been bringing or they have brought to our tables. So we really need to know more about some of these things. So let me quickly just use the remaining aspect of our time to touch.
Please, ma, I have a question, ma.
It's okay.
Yes, ma, this CBT, for instance, when we're growing up, there are times probably we are misbehaving and our parents might not talk, they will look at us. And that one will affect our own what's thought and change our behavior. Then how can we now align with this CBT? Does it have anything to do with it?
Yes, it's still a therapy.
Okay.
That is a looking therapy, a hopeful looking therapy. Because at the back of your conscience, at the back of your mind, you don't want to do anything that will contravene the norms or the positive norms around your parents. You want to do what your parents values and praise you. You know, if you can recall back those days, if they send you message and you do it promptly the way it ought to be done, I'm sorry for some of us that did not hear Yoruba here. The parent will say, o ṣé ọmọ mi, ayé rẹ̀ á dára. That's thank you, your life will prosper. And at the back of your mind, you'll be so pleased. Even if they don't do anything apart from that, you're so pleased to the extent that you'll be so comfortable and comfort with that little word. But now you can see some of us, especially most of us that are educated, when you send your children something, those praises are not forthcoming again because you don't see reason why you just need to praise unnecessarily. You think that, okay, I send you message, you did it for me. Is it up to what I have been doing for you? Or maybe we just overlook that aspect of the therapy, which we have advantage of having from our parents. Because those days, they will pat you when you do something right, they will praise you, sometimes they embrace you. The highest we can do now is maybe when we are coming back and they quickly come for us, they don't even come to embrace you. The children of nowadays don't have your time. They only open your door or you open your door by yourself and say, welcome, welcome.
Yes.
Nobody struggle to open door for you. Those days, we struggle to open doors for our parents to come in and we welcome them. Now there's nothing like that. So some of these cultural norms and involuntary behaviors have been left behind, and we have embraced the modern socialization, which has taken some of these cultural norms away from us, and we have adopted some of this foreign culture which has wailed off some of the behaviors that were planted in us those days. So those days when you do something and your mother or father raises their eyes up and bring it down in a latching position, you quickly position yourself so that you don't get scolded by them. But children of nowadays will ask you, mommy, is something wrong with your eye latches? It's blinking. And you quickly adjust yourself
Yes, sir.
so that people around you will not know what is going on between you and them. Those days, when you are doing something naughty and those our mothers come closer to you and just use their leg, their foot to match maybe your slippers for not to hurt you, you will quickly understand that they don't want you to go ahead with that particular behavior within that environment. But these days, if you try it, the children of these days will ask you, Mom, did you want to spoil my slippers? You want to cut my shoe? Why are
Yes,
you
sir.
meeting me? So we have erroneously adopted some foreign cultures that is not our own. We have weighed off our own cultural beliefs and values for those modern ways of life. So we might not really get the therapy the way we ought to get it from those days because of the values attached to those things. There are no values attached to those things nowadays. That's just the difference. Then values are attached to snubbing of eyes, to blinking of eyes. Now, no values are. If you ease now, the children of nowadays will ask you, you are easing, hope no problem. Are you having stomach ache?
Abi? You are right, ma.
But if our own parents ease us at us, the first thing that your brain will tell you is that, oh, I have messed up myself again.
Mm.
Then you start thinking about what have I done wrong so that I don't take these slaps of my life when we leave these premises. So those are the issues we are talking about. That's why I said those behavioral therapy of those days, those values that we attach to so many things. Now we overlook so many things and it's becoming a social norm, a social problem. Look at it. Many of us, we open our house something proper. Those days, if you misbehave and dress unwantedly, your parents will send you back into wherever you are coming for to go and dress properly. They will not allow you to go out. Even those days, your outing must be permitted by your parents. They must be planned by them. But we have adopted some foreign cultures whereby we leave our children at a particular age to go and play, to go and socialize. We don't even monitor
Them.
Monitor them again.
where they are socialized a lot. The children will stigmatize you. They will do some things, they will hide some behaviors from you. Please give me 2 minutes. Let me attend to somebody. I will come back to the class.
All right, ma.
Hey,
Okay,
ma.
ma.
Wow. PPT.
I think the topic is broad.
It's broad. Seriously broad.
Totally.
So we need to go back to the drawing board and read.
And read very well.
Need to read very well. Then understand.
Hmm. Please, where do we share our
Like
assignment?
Dr. Ottun was
On
saying.
our own,
Where do we share
on
our
I'm back.
assignment?
I'm back.
our own
Sorry, I'm back.
platform.
Oh.
So those are the problems we are having now. Now, let me give you some examples of some of these things we are discussing now. For example, in the early 90s, you cannot dress, wear a jeans, and it will be torn somewhere. If you are not corrected in your house, police will arrest you, or a soldier will just take you to their van and take you to their barracks. It means you are having mental touch.
Yes, sir. Yes, sir.
But now, this is 2025. You will even see an adult, mommies and daddy, dressing with a crazy jeans. They call it a crazy jeans. Why are we wearing it?
Because
Well,
they
Does
are
it mean we
crazy.
are crazy?
Because they are crazy, man.
We are not mad.
Those are the issues. We have overlooked a
Some
lot of
very common
things.
sense.
That's the only common clothes, and they are even selling it more expensive than the normal jeans.
Oh yes.
Those are the issues we are talking about. To some people, they create it as a style for themselves, and it's a positive thing to them because they are making money from it.
Hmm.
They are eating from the public from that. Because by the time they look at those jeans, the torn jeans that is already tearing wherever it is kept, they look for somebody to just put it together for them as a wear, and they take it to market, and somebody will work, a very same person will work for 36 hours if time takes some people in a day, and not 24 hours. They will work and put their money together and go and purchase this type of a jeans. When a good jeans is there at the BQ center and they are selling it 200 naira, 500 naira, we will buy the crazy one for 25,000 naira. And we think we have arrived. Now, those people felt that if you can buy the torn one for 25,000 naira, then let's be tearing it
Mm-hmm.
and be giving it to them. We make more money. The same thing happens to drug. The drugs that are making them to go crazy, no doctor will recommend it for an ordinary person. Some group of people felt that when they take this drug, they have energy to do some vigorous job, and they take it and they start doing the job, and we are able to earn their earning. Then they introduce it to some group of people again, and they also try to buy it. And before you know it, the particular drug saturated the market. We now say we ban it. And some people are getting more money from the banned drugs. So even when you ban it, they will have their ways of bringing it in and selling it secretly, because they are making money from it. So to them, those drugs are bringing in positive things. If you ask them about this drug, they will tell you, am I crazy? Why should I take it?
Others.
But they are the ones selling it. You will see some of them, they bring in dye that we supposed to use and dye cloths and do a lot of things and gain from it. They add the original ones and they start to use it on their head and paint it gold, paint it yellow, paint it silver, paint it grey. Why those who are having grey hair will busy go to market and look for black dye to dye their hair. So the youth that have the black hair went to market, take yellow color to color their hair, take grey color to grey their hair, and series of colors like that. So tell me, those who are selling dye, Did you want to tell them that you should not sell to the youth? If you said they should not sell to the youth, adults will go and help them to buy and resell to them and gain more money.
Madness everywhere.
So those are the issues. So we have a lot to do. That's why I said we did not really go deep into that cognitive behavioral theory. We don't go in but deep into it. I want us at this stage to be going deep into. You see, if you go into cognitive behavioral theory, you will see that it's borrow some other theories. Like motivational theory, for those who look at the positive aspects of this impact of social issues, and another theory for those who look at the negative aspects. The learning theory is there. I'm happy that somebody mentioned that. If my father is on dreadlock, my mother is on dreadlock, nothing will stop me not to be on dreadlock. If my mother is a dancer, my father is a dancer, nothing is stopping me not to be able to dance better than all of them. Because I've been learning their footsteps, I learned the way they dance, I learned the way they dig it, they roll it, they come down, they come up, and people are praising them. Then I will do smarter than them. So, cognitive behavioral theory is a theory that talks about how to recognize some of these norms that are negative in the thought of the person that needs the therapy. Once we recognize what are negative in their thoughts, we now try to change this negativity to a positive one. Sometimes what is negative in their thoughts might also be a non-valuable norm in a society where they are. So it is negative plus negative. For us to have the positive negative now, it is now our own duty as social worker to now sit down and plan the therapeutic steps to take. Because if negative is plusing negative, we still have negative. But how do we make that negative that is plusing negative to be positive in the eyes of somebody that is already having a negative feeling? So those are the issues that we need to really deep into. You can see that it's not a type of theory that we could easily and rush it like that and say we have done. No, we still need to go back after exchanging all our papers that we have presented today. Let us go back and read more about all those therapies that we have touched so that we don't have problem. Because when we talk about depression, it's not just happening to one person, it happens to a lot of people. And cognitive behavioral therapy cut across a lot. It also affected the family. It also affected the changes that happen in the family. Because some family believe that if a woman is having girls, so their son should go and have a boy outside the marriage. And they have started the problem for the guy. And by the time he moves out and he has another girl there, he will move to another, because the family has encouraged that. And along the line, if he die from the cause of looking for a male child, to be a heir to the family he did not take his time to nurture. He could die along the line. He might not die along the line, but he has created a lot of problem to the society, not just his family alone. He has neglected some children from having the father figure. He has neglected some children from having what it ought to take to have a good and quality standard family. He has indirectly brought a social problem into his family, into the society. Because some people will see him as a role model. His own children that he left behind is already having problem with the developmental skill, which is another theory for us, developmental theory, where we talk about Erik Erikson and some other developmental theory. The child that did not see somebody that will so-called the aggression the mother has passed, and so many things in the family, will now grow up, have some other psychological issue, will not see man as being reliable. Some get affected to the extent that they don't want to marry. And it's affecting some of our female children now. Some will be 30 something and they still tell you we are not ready for marriage. Some men will be 40 something, you will be begging them, please, story along. If you cannot see anybody to marry, I should bring a cripple for you. They will laugh at it. No, don't worry. I will get a woman. Because they are looking for that perfection woman that their father went to look for and die along the line. They have not seen. Because their father did not embrace their mother. So the behavior of their mother is negative to them. They are looking for a woman with the right behavior. They will not get married. And some, if they do, and the woman mistakenly has traces of 1/4 of their mother behavior, they will quietly live the way their father quietly left them those days and go and remarry again. So there are social issues that we did not really see as problem, and it becomes problem on the long run. That is what cognitive behavioral therapy want us to look at, so that we will look at problem, we will be able to look at where the problem starts from, the background of the problem, and then we will now diagnose what to use to solve the problem to a reasonable stage where the person can be useful to us again in the society. So let's look at conflict theory. Conflict theory is a theory. If I start to talk about cognitive behavioral theory, we might not leave this class today. Conflict theory is another theory that is very, very essential for us to know as a social worker, and also know when and how to apply them, so that we will not have issues. Can we start? Let's use the remaining few minutes to brush it, then we will come back again.
Okay, ma.
Are we ready for conflict theory? Are we ready?
Yes, ma.
Yes, ma.
Yes.
Yes, ma.
It's okay. Now,
Yes, ma'am. Yeah.
you will see me bringing in conflict theory because I just want you to really get some things very well. We could have treated some other theory which we will still treat, but I want us to come to conflict theory before going back to some other theory. Now, when we look at our lives, it all seems as if there is conflict. It all seems as if we are all on the battlefield. It all seems as if we are in the boardroom waiting for the decision of some people that have the might and power over us. It all seems as if we are in the bathroom, we want to wash away some dirty things that have attached to the skin and is making us not to be comfortable. Now, conflict is simply like a struggle that many of us are trying to resist. We want to strike and oppose the opposite forces that we think is dragging us to somewhere that we don't really want. Sometimes conflict might not come if there is no other person around us. But many a times, once we have two, three people, we always view conflict in different directions. But then conflict is good for us in our life. Because if there's no disagreement, there will not be agreement. So many a times we should look at conflict from different perspectives as a situation that reflects our differences, our personalities, our values, our ideologies, our cultural beliefs, the races, the behaviors that we have. So, if we look at it from all this perspective, we will see that there is every tendency that we have misunderstanding with one another. So these misunderstandings are the things that we work on so as to really understand what conflict is all about and what conflict theory is trying to talk about. Because in the first instance, you will see that many of us within ourselves, we are not living according to our own values. We always see that these our values are being threatened. Then there is fear of unfulfillment within us. So there is issue of helping to raise what actually is this value, trying to address what the problems are. We now put up our energy to really appropriate the issues. Then sometimes if we have a very good courage, we encourage ourselves to put in our best so as to recognize, learn from people, and look at the benefits that we have from their differences from us. Because if we don't look at this, we might not be able to be productive. Because once there is conflict, we might not be productive. Our mind will go there. We want to struggle with our values. We want to struggle with ourselves. We want to struggle with things that we think is oppressing us, is stressing us, and so many things. That's why I am taking this now so that we prepare our mind as social worker. We are different from sociologists. We are different from philosophies. We are different from so many other fields. We are problem solvers. So if we are unable to identify that issues, it lowers our morale. And this will continue to cause more conflicts within ourselves. And from there, we have some inappropriate behaviors that will lead to poor communication, either in our workplace, either within our family, with our children, with the neighbor, and so many other things. So many a times, it is very, very necessary for us to really look at how to minimize conflict by identifying the roles we are to play, by making sure that we did not crack. So once the role we are to take is more than our own capacity, we drop it. That's why we use agencies when we practice. As a social worker, we intentionally build relationships with all our subordinates. You build relationship with all your subordinates so that by the time the job is much on you, you will be able to share it appropriately and people will be able to deliver to you when you are having the meeting, when you are sharing the knowledge, when you are talking about the challenges. We all brainstorm and get whatever we want. So as a social worker, it is very, very advisable for us to always document. We should document whatever we have done, even if you don't want to do it formally, but nothing is wrong with you from doing your documentation formally. So a social worker must be prepared to write notes. Write as brief as it could be. Write notes. Write reports. Document issues so that you will be able to get whatever you want at the right time. And manage your current issues based on the positions, the policies that you are having in the management, so that you don't get out of what your institution requires you to do. Please learn how to delegate and delegate properly. So next class, we are going to talk about conflict, types of conflict, how to solve some conflicts, and how to relate well with some conflicts. So I can give you an hint to the next class so that we will all prepare ourselves. We will all prepare ourselves, and if possible, let us also go ahead to divide this class. I will still talk more about it the way we have talked about cognitive behavioral therapy, so that we will all read. We will not come to class and be listening machine. There is what we call inter-organizational conflict. So please write it down, class rep, so that we can distribute and do our presentation again briefly, and then I will now go more into it. We have inter-organizational conflict. We have intergroup conflict. We have intrapersonal conflict. And we have interpersonal conflict. I hope you get it right.
Yes, ma'am. Yes, ma'am.
So please, let us distribute that within ourselves so that by the time we come back to the class, so we do our presentation, then I will now take the conflict management system designs so that we will all learn from this, and then we can go and pick another theory that is very, very essential again to us at this advanced level. That's why they call it advanced social work theory. We are not treating theory like before. Rather, we are thinking about theories that we do apply to our areas of practice, theories that makes us to function better like a social worker. So, any question before we call it a day? Please bring questions, we will answer you. Questions, please. The class is open. Ask your question. I want to learn from you too.
Any question, class?
No question.
All right.
Do we enjoy the class?
Well said, ma. Yes, ma. Well explained. Thank you so much.
Mama.
Thank you, ma.
Yes,
Okay.
ma. Thank you, ma.
Thank you for coming. We have a new person among us today. Mr. Smith, you have the floor. Introduce yourself to the class.
Mr. Folonshaw, welcome, sir.
Mr. Smith, please introduce yourself to the class. You cannot just come and join us and do hide and seek. Àwọn tó máa ń tan máìkì ilẹ̀ tí wọ́n ń sin kíláàsì nù.
Abi. Okay. Okay.
Ó ti lọ
Welcome,
wáwó lọ.
Folonshaw Smith.
Ó wà ń bẹ̀. Ó ti lọ wà ń bẹ̀.
Ah, Àló ti tán kinní lẹ̀, ó ti ṣeré lọ.
Lord have mercy.
Gbogbo class ẹ̀ fáìní ẹ̀ tó bá ti dé next week.
All right.
Mr.
Okay.
Smith, for the last time, introduce yourself.
Yeah.
Mr.
Ṣẹ̀gbọ́n kò
Smart.
sí ń bẹ̀.
It's not there. Oh.
It's not there. Ó kàn tán kinní lẹ̀ ń lọ ń ṣeré ń tiẹ̀ ni.
It's there. He said I'm here, ma.
For where?
Okay.
Yes,
Àwa ò gbọ́ o, ẹ̀yin nìkan lẹ gbọ́ o.
I saw it on the screen, ma.
No. Well, it's not on mute.
Ẹ̀yin nìkan lẹ gbọ́ o, Mrs. Akínníyì, àbí ta ní gbèjà rẹ̀?
Akintunde. I don't know him, but he just put it on the screen now. I'm here, ma. I'm here, ma. I don't know.
Introduce yourself. You are
We're on the screen.
It's like it's
mà là ń sọ ní ẹ̀rí
even
tó tún káwó òkè. Introduce yourself. Don't mind him. Off your speaker.
Okay.
He doesn't want us to see him.
Okay.
It's okay o. We call it a day.
All
Bye
right.
Mommy,
bye
God bless you, ma.
everyone.
We really
Yeah.
enjoy your class, ma.
Thank you, ma.
You're
Have a
welcome.
lovely day.
Thank you.
Thanks for today's lecture. Ma.
All right.
You're welcome.
So we will do
You're
our assignment and we will also share that CBT class, ma. I mean,
Yes.
assignment.
Yes. Please share. Then this one, learn about this conflict issue. Then
Okay.
we'll talk about it more.
Okay.
Good morning,
ma.
And
All right.
Mr. Smith, welcome to the class. Ẹ pẹ̀lẹ́. Ẹ káwọ́lẹ̀ kó má dàbí pé ẹ ń ṣàlùtù àwọn babaláyé ẹ káwọ́lẹ̀.
Abio.
I'm happy to join you. Aware is things that are generated out. We have an issue with life. I'm sorry, ma. I really enjoy it.
Class.
Submissive behavior theory. We also spoke about conflict theory.
Introduce yourself lásán o. Fi wálẹ̀ pẹ̀lú kíláàsì o.
Yes.
Okay. My name is Akiyemi Smith. I work with Federal Neuropsychiatric Hospital as a medical social worker. I'm a principal social worker officer and also specialize in substance use abuse and so many more concerning allegations of poverty, especially youth in commercial development. I'm happy to join you and it's my privilege to be your student. Thank you so much.
We are happy to have you in our class, sir. Thank you, sir. You are
welcome, sir.
Welcome. Welcome to class.
Thank you.
So have a pleasant day, everybody. Bye.
All right, ma. Bye-bye,
Same
ma.
here, ma.
Bye, ma.
Yes, ma.
Bye, ma.